So what happens if your water breaks and you start feeling contractions, but your baby is still preterm? Okay, don't panic. I'm here to take you through everything you need to know about preterm labor, from what causes it, how to prevent it, and what to expect if you find yourself in that situation. For those joining us for the first time, I am Dr. Koza, and I am your guide to navigating women's health in the public sector. Preterm labor is labor occurring anytime between 24 weeks and 36 weeks of pregnancy. So this can be accompanied by contractions, your water breaking, or you passing a bloody discharge that we call show. This puts your baby at risk of having infections, breathing problems, low blood sugar levels, jaundice, cerebral palsy, blindness, hearing loss, and even limb deformities. But there's no need to panic because all of this is preventable. Here's what you can do. Firstly, make sure that all your medical conditions such as HIV, diabetes, hypertension, thyroid disease are well controlled before you fall pregnant. Secondly, don't smoke. Don't take any alcohol. Thirdly, make sure that you are taking your folic acid and fish oil supplements well before you fall pregnant. So folic acid will be readily available at public health facilities. However, your fish oil supplements will not. So these you'll need to buy from either Clicks, Dischem, or in fact any pharmacy. You don't need a script for this. Fourthly, if you suspect that you are at risk of preterm labor or you've had a preterm birth before, please make sure that you notify your healthcare provider at the beginning of your antenatal journey. They will then refer you to a doctor who will assess whether you qualify for what we call a cervical cerclage, which is a stitch that is placed at the mouth of the womb, the cervix, to prevent it from opening up before time. There's also the option of using tablets that are inserted vaginally with the same aim of basically preventing your cervix from opening before time. The tablets will be stopped or the stitch will be removed as soon as you reach 36 weeks of your pregnancy. If you suspect that you are in preterm labor, immediately go to your nearest healthcare facility. You will then be assessed as to whether you truly are in labor, and the well-being of your baby will also be checked. You will then be admitted, and depending on how far your pregnancy is, you could receive antibiotics, medication to stop the contractions, medication to make sure that baby's lungs develop a bit faster in case the delivery does progress and baby comes before time, and also medication to protect baby's brain just in case they come before time. On the other hand, your doctor might not try and stop the progress of your labor. This could be because baby is big enough to survive even though they are less than 36 weeks, or the benefit of delivering baby outweighs the risk of keeping baby inside you, or perhaps you're just too far gone in labor and there simply isn't any way to stop the progress of your labor. All right, I think I will stop there for today. If there's any aspect of this talk that you'd like me to elaborate on, please, you know what to do. Just leave me a comment or DM me. And don't forget to like, follow, and subscribe to this channel. Till next time, ladies, take care.